you. Can
Ambassador Rice and Secretary Chertoff, if you can hear me, can you give me a thumbs up?
I don't think
Test.
they can hear you.
Ambassador Rice, if you can hear me, can you give me a thumbs up? Ambassador Rice or Secretary Chertoff?
Are we unmuted, guys? I see a mute on our screen.
They're on the phone line. Okay.
Can we pull the phone up on the table?
Now you can hear us?
Okay.
Okay.
We have it down here because of the review system here, so it feeds interrupting. So if you just talk into your microphone, we'll do that.
But can I hear them?
We have a microphone.
Okay. Are you ready?
Just one more time, just make sure they can hear you.
Will we be able to speak or not?
Can you see me, Madam Chair?
No.
What does she need to do to see us?
She can hear you.
Okay. Should she turn on channel 13? Does she?
I think they have it, it's just delayed.
All right. You need to call, Andrew and you guys need to call out the slides or text us when we're moving so we can know when it's our time to speak.
Yep, we'll do. We'll do that.
Because we can't see anything except each other.
She can't get the slides on her screen.
And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Yep, what about? Thank you. Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. This morning, we are going to hear from the Reopen D.C. Advisory Committee with their recommendations on how to reopen Washington, D.C. Following their presentation, I will provide a brief situational update, and then we will take questions from the press. It was just a few weeks ago that I introduced Ambassador Susan Rice and Secretary Michael Chertoff as the co-chairs of the Reopen DC Advisory Committee. They each bring an abundance of experience, energy, and talent to this process and decades of living in Washington, D.C. We knew they would jump in feet first, but I think we have all just been delighted about the amount of time and energy and expertise and know-how that they have brought to this process. I commented to each of them that it was probably an unexpected but also interesting detour to get so deep into their local government, and we have benefited as well from that experience. We asked them to provide a 10,000-foot view and a microscopic one, and they did so with excellence. And we also asked them to devote themselves to hearing from D.C. residents and businesses who have been particularly impacted by COVID-19 and the shutdown of our economy. So I want to thank them for graciously accepting these roles and working so hard. And I am pleased now to turn it to them to talk about their recommendations. And Secretary Chertoff, I think you're going to begin.
Madam Mayor, I think Michael, are you able to hear now?
I think Secretary Chertoff is trying to get on.
Michael, are you able to hear?
What are we doing?
If not, Madam Mayor, why don't I go ahead and jump in, and Michael connects, I'll will
We'll,
hopefully
we'll
allow.
have him call in
to
shortly
him.
or reconnect with him. And Ambassador, I have your slides. So why don't we begin? We'll put your Reopen DC Advisory Group slides on the screen, and you can talk to them and let us know when you want to advance.
Thank you so much. First slide, please.
You got it.
First of all, Madam Mayor, Michael and I want to thank you so much for this extraordinary opportunity to work with you and your first-rate team on this very important effort for DC residents. Just over 3 weeks ago, you tasked us with an ambitious and critical charge to return recommendations to you on how best to reopen DC in a phased way that can both reduce health risk and live up to the values of Washington, D.C. Today, we share with you our reopening recommendations based on the work of the 11 different committees focused on different aspects of the district that were synthesized by the steering committee. These recommendations come from both community and government leaders based on your broad stakeholder engagement, research, and expertise. Next slide, please.
We're on now.
You've got it.
Slide 2.
Slide
Over
2.
the course of 3 weeks, the advisory group has not only gathered best reopening practices from across the country, but more important, has heard directly from thousands of residents, businesses, and stakeholders here in D.C. In addition to a survey that received over 17,000 responses and a town hall that reached over 10,000 participants, the committees held hundreds of focus groups and interviews. Given the short timeline, this was a truly impressive amount of engagement and helped us create well-informed recommendations. Next slide, please, Madam Mayor.
You've got it.
Through the survey, we heard some unusually clear messages, which also aligned with 85% of respondents supporting the current stay-at-home order and posture, and many highlighted the importance of clear guidance and communications around what is allowed and what is safe. Nearly 2/3 of respondents support a phased reopening. Many recognize the economic damage, especially to small businesses, that closing has caused. Just over 8 in 10 respondents shared concern about equity and vulnerable populations. They recognize that the negative health and economic impacts of COVID-19 have not been distributed evenly, but have been borne by our communities of color and low-income communities disproportionately. The disease has only exacerbated already wide disparities in our communities. I believe we have Secretary Chertoff now.
Okay.
Mr. Secretary, I've just gone through slides 1 through 3. We're starting on 4. If you want to pick up there and go as long as you'd like, I'm fine. We're calling a bit of an audible here. Mr. Secretary, I think you're on mute. On the phone there. Still can't hear you.
Okay, yes, can you hear me now?
Yes.
Yes, excellent.
Okay. Modern technology, it's just really, well, listen, I'm delighted to be on, and again, let me echo the remarks made earlier about thanking the mayor for her vision and her mandate to us with respect to hope, which I think is very important. In line with that vision, we did anchor our efforts in the values of hope, which are health, opportunity, prosperity, and equity. And these values guided all of the dimensions of our consideration and deliberation on the advisory group's recommendations. From collaborating with DC Health and national public health experts like Dr. Anthony Fauci and the faculty of Johns Hopkins Bloomberg School of Public Health, We also work closely with residents, community groups, and business and civic leaders, and the recommendations we are putting forward reflect our city's deep commitment to all of the values embodied by these groups. Now, let's be clear. We acknowledge that with reopening comes some incremental risk. This is about risk management, not risk elimination. But we are using the HOPE framework to help guide our planning and inform us how we can reduce risks while moving DC to a new and better norm. So let me just maybe briefly cover some of the critical elements of this approach. First and foremost, reducing the incremental health risk, although not eliminating it, is a primary goal of our recommendations. As we've seen in many other jurisdictions, DC Health has laid out metrics that will help shape the gating criteria to move between stages. And this will be a guide to recommend that when the reopening happens, it happens in stages, looking to things like a level of community spread, testing capacity, healthcare system capacity, and public health system capacity, which includes contact tracing. These gating criteria are a gauge to determine the right time to proceed and to recognize whether we need to dial back if it turns out that things take a turn for the worse. So our recommendations provide that stage 1 is characterized by decreased community spread, allowing for key low-risk activities with strong safeguards to resume for less than 10 people, and continuing to encourage telework. Stage 2 is when we get to the point of merely localized community spread, and at that point we would allow additional activities to resume with strong safeguards, including limiting gatherings to 50 or fewer, and still recommending telework. And stage 3 is characterized by sporadic community spread, which would allow at that point for higher risk activities to resume with gatherings up to 250 or fewer residents. And telework should still be encouraged, but travel could resume. Stage 4 is ultimately what we all hope for and long for, which is a vaccine that makes this problem totally recede. And finally, Susan, if you want, I'll continue with the 6th slide.
Go ahead, Michael. Thank you.
Okay. Across all the stages, which are in many respects directed to what employers and venues should be doing, we are counting on the citizens of the district to engage in safeguards on their own, as well as all businesses. And these are going to be universal across the board. Our success depends upon the commitment of individuals, employers, and venues to adopt these rigorous safeguards to reduce risk, even as we move stage to stage. And the measures are recommended and should remain in force through stages 1 through 3 to help protect personal and community health. These include physical distancing, wearing masks, and sanitation practices. In line with our shared values and our interaction with members of the public, it's worth noting that 82% of survey respondents did express concern for vulnerable populations, and this was the topic most marked by respondents as, quote, keeping them up at night. And that's why we've gone further to recommend safeguards, in particular for vulnerable populations, including where additional exposure risks may exist, for example, communal living. Public and private efforts should be in place to assure access to hygiene and sanitation supplies, testing, and safe isolation for our vulnerable communities as needed. And now let me turn it back, Susan, to you for slide 7.
Yes, thank you very much, Michael. Now to Andrew Trueblood.
Thank you, Ambassador Rice, Secretary Chertoff, and Madam Mayor. Now we will walk through the advisory group's sector phasing recommendations to the mayor. The recommended staging aims to protect public health, to start restoring livelihoods, and to support our communities with needed spaces and services. The staging recommendations look across all components of DC life to account for the critical interactions across areas like transportation, childcare, and employment. The advisory group made recommendations across 25 business functions and areas that were placed into 4 categories of work, learn, engage, and access services. For each area, the advisory group considered its risk based on DC health data and national public health sources, while also taking into account the ability to mitigate the risk, its impact on equity, and its economic effect. I will walk through this table, which shows the first 2 categories of work and learn, while Lindsay will share the engage and access services recommendations. It is worth noting that the full report has sector committee appendices that provide more detailed sector recommendations. Finding a path to begin safely restarting the district's economy starts with our employers, and especially our small businesses. The advisory group recommends Stage 1 take an incremental approach, with personal services such as hair salons and barbershops allowed to operate with strict capacity restrictions, with retail allowed to provide curbside pickup and delivery, and with restaurants allowed to provide outdoor dining with safeguards. Starting in Stage 2, it is recommended that restaurants, retail, and additional personal services be allowed to open up indoor spaces with strict capacity limits, which could be slightly relaxed in Stage 3. As the Secretary mentioned, telework for office workers continues to be recommended across all stages, and office spaces are recommended to operate with capacity limits starting in Stage 2. Finally, places like bars and nightclubs are recommended to begin reopening in Phase 3 with strict capacity limits. The advisory group recognized that education and childcare is a critical component of reopening and for the success of our children. Stage 1 is recommended to include limited activities and offerings such as childcare with restrictions and prioritized for children of site-critical and essential workers, and curbside library service. In Stage 2, all activities, including summer camp and museums, are recommended to begin functioning with strict capacity restrictions, which could be relaxed slightly in Stage 3. Recommendations for pre-K-12 and adult education offerings include a phased reopening starting in Stage 2 that prioritizes students who most benefit from in-person instruction, such as those in transitional grades or children of site-critical workers. As more students return to the classroom, there is the recommendation that schools consider an A-B schedule, wherein only half of the students are at school at any given time, in order to stay within capacity limits. In Stage 3, the advisory group recommends that all libraries and child care facilities open with restrictions. Finally, it is recommended that colleges and universities submit their plans to DC prior to reopening. Now, I'd like to turn to Lindsay to walk through the Engage and Access Services recommendations.
Thanks, Andrew. The advisory group made recommendations to the mayor in regards to activities that we all long for again, places to engage with our friends, neighbors, and families, places of worship, large outdoor gatherings, indoor venues, gyms, parks, and pools. In Stage 1, the recommendation is that parks and fields could reopen for individual or family recreation in groups of up to 10 with safeguards, while playgrounds are not recommended to be open until Stage 2. Places of worship could continue virtual worship services in Stage 1 with groups of up to 10 people. More activities could be able to be reopened in Stage 2 following the same recommended universal safeguards, including that groups should be no larger than 50 people with physical distance safeguards in place. The advisory group has also recommended that gyms and workout studios reopen with limited access, specific square footage included, with specified safeguards and physical distancing in Stage 2, with pools following in Stage 3. The advisory group also made recommendations to the mayor in regards to accessing services that we all depend on. In keeping with the office worker recommendations that Andrew just spoke of, the advisory group recommends that those district government and federal government employees who can telework continue doing so for Stages 1 and 2. The Metro General Manager, Paul Wiedefeld, briefed the steering committee on the plan he shared with the public last week, which is keeping with the spirit of the recommendations laid out by the advisory group. and would accommodate increased demand throughout the stages. Equally important are the shared transit providers, providing only essential trips today, which the advisory group recommends continuing the current posture in stage 1, with non-essential shared transit resuming in stage 2. And then in regards to the heroes of this unprecedented moment, our healthcare providers, the advisory group recommends that per DC Health's guidance, they be allowed to deliver inpatient and outpatient care with providers monitoring and preserving the health system capacity needed to address the current pandemic. And with that, I'll turn it back over to Ambassador Rice.
Thank you very much, Lindsay. Slide 9, please. Mayor Bowser charged the advisory group not only with recommending phasing and practical guidelines, but also with identifying new opportunities and cross-cutting needs. Through our stakeholder engagement, multiple ideas emerged as to how to reopen and to build back better. These recommendations cut across sectors and activities and include coordinating the reopening of critical economic and social enablers such as education and transportation, the desirability of reconfiguring our streets and sidewalks to support pedestrians, bikes, and buses. We also recommended ideas for supporting businesses or organizations as they reopen through such efforts as supplying free or discounted personal protective equipment and cleaning supplies, creating additional outdoor space for restaurants and retailers, and launching a certification process to help businesses inspire residents' confidence. Recommendations on how to ensure an equitable and inclusive reopen also surfaced, including the critical importance of providing free broadband internet access, devices, and personal protective equipment to low-income and vulnerable populations, ensuring that our communications around reopening are accessible to various populations, and monitoring the current and ongoing efforts on our and monitoring the current and ongoing effects on our vulnerable populations. With that, we'll wrap up on slide 10. This is a summary of the values, staging, and safeguards, as well as the gating criteria. All of this information and much more, including the detailed reports produced by the committees and a summary of each committee's recommendations that relate to the 25 business functions and activities that we walk through, are available in our report, which can be found at coronavirusdc.gov/reopendc. While these are not policy or official government guidance, we believe these overall recommendations, as well as the very detailed committee work, will be valuable for Mayor Bowser and her administration as they make decisions and create policies and programs to help Washington, D.C. reopen and recover in a way that gives us all hope. Thank you very much, Madam Mayor.
Thank you very much, Ambassador Rice, Secretary Chertoff, to all our steering committee members who have joined us on the line as well and who are available. To the staff, to the Reopen Committee, let me start with Andrew Trueblood and Lindsay Parker, who helped staff the Secretary and the Ambassador, as well as the Health Advisor to the committee, Dr. Nesbitt, and all of D.C. government folks who staff the 11 sector committees. Bravo. Thank you so much for the work that you have done. I want to turn quickly to our update on a situational update. I'm going to say a few things. Dr. Nesbitt will say a few things, and then we will turn to your questions. This morning, we reported 237 cases of COVID-19, bringing our confirmed cases to 7,788. And sadly, we also report that 412 D.C. residents have succumbed to this virus. And as we think about reopening, we think about those families, those people who have been impacted by illness and certainly death, but also the many families who have been impacted by a loss of their income, their job, or their business. And so the work that we do here today and the recommendations that we consider are very critical to how our city moves forward. These numbers, though, are stark reminders that this virus still poses risk to our community, and that's why we continue to be very careful about our decision making. I can also report that we are in 11 days of sustained decline in community spread. And I know that people are very eager to learn more about how we are following all of this data. And so each day we will share a new community spread graph on our data page at coronavirus.dc.gov. And I'm also going to ask Dr. Nesbitt to walk through this graph and the graphs that she confers with each day to report on community spread. Dr. Nesbitt.
Yes, thank you, Madam Mayor. So we had this is a great opportunity for us to be able to put in context the community spread. And given that we are reporting 237 cases today and also reporting the 11th day of decline, it creates a tremendous opportunity for me to be able to explain how we can continue to do that. One of the things that happens in many communities is that we have been reporting to you the new number of reported cases, which is a very different metric than what I look at as the state's public health official and what many of my colleagues who manage public health agencies across the country look at on a regular and daily basis with our staff epidemiologists, our state epidemiologists who advise us on the management of the pandemic. What you are seeing before you is essentially our epi-curve. So when we are talking about, and many of you who have looked at the now famous CDC guidance document that circulated that talks about looking at a decline in new cases, is looking at a decline in the incident cases in your community. And that is often monitored in communities by the symptom onset date. The number of new cases that we report to you all daily is not the same as the cases by symptom onset date that are up here in our epi curve. So what we are going to be presenting to you now moving forward is our epi curve, or a snapshot of our epi curve. And when we talk about the community spread, it's our epi curve minus the cases from the congregate setting. So if you look at the next slide, you will see the yellow line or the mustard colored line is an epi curve showing all cases. So those are all of the cases that have occurred in the district based on the symptom onset. So the 237 cases that we're reporting to you today, we have one of the laboratories in the district that was experiencing a backlog. So they all of a sudden reported to us a number of cases where individuals may have been tested at various points of time. Their tests were sitting in a laboratory. Those results came into us. Those individuals have various symptom onset dates, and now the results all come to us at once. We could have a date in the future where we may present 500 new cases that we are publicly reporting because all of those lab results come to us at one time. The symptom onset dates of those individuals could range for a number of days. The epi curve is helpful because it allows us to place those individuals' dates or symptom onset date on a curve and allows me to know when were those individuals present in our community posing the most risk of spreading the virus to other individuals. And that's helpful for how we manage the pandemic, and we know when the risk of spread is the highest in our community. So managing the pandemic by symptom onset date is a lot more useful than managing the pandemic by the number of cases reported out by when you receive the lab report on any given day. So what you see here is if we were following all cases that are reported, which is the yellow line, the number of reported cases that are occurring broadly in the community, or the number of cases that are occurring in congregate settings. Now, we remove, if you go to the next slide, and only look at the blue line, which are the cases that are occurring in community or community spread. So the community spread tracks the amount of virus circulating in the city. We remove the congregate setting cases, which are happening in long-term care facilities, detention centers, and other places where we would have the ability to work with those facilities to implement infection control practices or quickly respond to what may be happening in those facilities and contain the spread of that virus and reduce the risk to individuals who are in the community at large. So the processes for reducing transmission would be different. Now, you can see that we have started to track the decrease or the decline that we have from May 1st and continue to see a decline. We don't respond to one day up and down because we allow for a standard deviation of a rolling average. It's something that we calculate with our statisticians and epidemiologists, so we don't have to respond to one up and down day to day, and it's agreed upon epidemiologic practice. I can go more into that if people really want to know the details behind it. But we look at a rolling average for a number of days. Some cities and states use 3 days, some cities and states use 5 days, and we're using a 5-day average. It helps us smooth out the curve to allow for that statistical variation that could occur. So you can see here, we've had a decline since May 1st, and we're on our 11th day of decline. Madam Mayor?
Thank you, Dr. Nesbitt. And now I just want to talk quickly about the various metrics in addition to community spread that we are looking to determine our readiness for phased 1 reopening. Dr. Nesbitt has already mentioned the 11 days of decline in community spread. We've talked before about the transmission rate being below 1 for 3 days. We're at 9 days below 1. We're also very focused on our testing capacity, and presently we have the ability to test all of our 4 priority groups. And next week, I look forward to sharing with you how we're advancing our testing strategy to reflect a phased reopening, and we'll be able to talk to you about that next week. Our healthcare capacity is also very critical because what's important for everybody to recognize that any reopening means that more people will be mixing, more activities will be opening, and there will be more infections in the city. So it is very important always that we are monitoring the capacity in our hospitals to treat people who may become infected, and also to treat people who just have illnesses not related to COVID-19. So we watch this number very carefully. A last issue we've also been talking to you about is our contact tracing capacity. And we are close to where we need to be with contact tracing to be able to meet the goals laid out by the Department of Health. And that is, once we have tested someone, that we quickly have the ability with our contact tracers to contact them and their close contacts within 2 days, I think, for both. So we're getting there with that as well. In fact, we think that our first group of hired tracers will be fully trained by June the 1st, adding to the department's capacity. And so we're getting there with that. So let me tell you what is possible. Given this information and given the recommendations from the Reopen DC Advisory Committee. We are going to monitor throughout the weekend the trends that we see. And if those trends hold next week, by the end of next week, we will be able to communicate the start of our phased reopening. And so that means everybody needs to pay attention and get ready if we are able to have a phased reopening so that we can do it safely. Tomorrow, we will release a checklist, a reopen checklist, primarily for businesses to understand what they need to do for their business, their employees, and their customers. So please stay tuned for that checklist. We launched a pilot last week focused on education in the arts and student learning for a few businesses across the district. They provided us some information about how they were thinking about reopening, which was helpful for us to read, but also I think helpful to their business colleagues to think about the things that will be necessary to reopen. On Tuesday, we will talk a little bit more about how we will operationalize the committee's recommendations. These are recommendations that don't have the force of guidance or law or a mayor's order, so we will need to review them very carefully and convert them to the necessary guidance. And finally, barring any peaks that are outside of what the doctor just discussed, we will be in a posture to begin a phased reopening next Friday, May the 29th, in Washington, D.C. Let me be clear about what this is and what it isn't. It is not an on and off switch. We will not be able to go back to life as we enjoyed it in February, but we are incrementally adding activities back in our lives, which we all miss and are all eager to get back to. And staying open and being able to manage this virus means we all have to do our part. Masks are very critical, and it was emphasized to us, to the committee yesterday by Dr. Fauci, how important it was for people to be wearing masks. And even in the activities that we're adding on, how important it is to be wearing masks. Staying home when sick, social distancing when you are out, frequently washing your hands and disinfecting frequently used surfaces, and testing and contact tracing. So part of what we will discuss with testing next week is how your doctors and our community health providers and hospitals and citywide services are all available for testing, but also keeping in your mind, if you are infected, that one of us from D.C. government, a contact tracer, is going to call you and ask you how we can help stop the spread of disease by tracing your contacts. So just have that in mind, that that's a new thing that will be present in our community because that work will keep this virus from spreading in our city. So with that, I'll stop talking and we'll take questions. Yes, Sam.
Yes, Mayor. How do you move between phases? What's the criteria of moving between the phases? Is it time? Is it certain results? Or do you know yet?
We do. And let me just say this, that the committee has been very careful to make sure that we're turning on activities to start our economy moving, get people back to work, allow people to have the personal services that we've been all missing. But we haven't turned those things all the way up. And part of that is to let us get a little bit of the economy moving, but not turn it up so much that we can't get to phase 2 or phase 3 for many, many months. So that's part of the thinking behind the strategies before us. And I'll let Dr. Nesbitt talk generally about how we advance.
Sure. So thank you for the question, Sam. And it's important to remember that the initial criteria that you've been seeing is what we call our gated criteria. And that's the criteria for us to begin the phased reopening. For us to move in between phases, some of the things that we're going to be looking at will change slightly. So it's not so much that we will only be looking at whether or not we continue to have a decline in these 14-day increments, but we'll also, as we begin to do contact tracing for everyone who's positive, we're going to need to see a significant proportion of people we're contact tracing that we can identify their place of exposure or where their exposure to COVID-19 was. So if you go all the way back and remember our conversations we were having in March, and it was a big deal when we had our first case that didn't have a known exposure, we want to get back to that being a big deal. So that we have everyone that we are in contact with, or not everyone necessarily, but a significant proportion of the people that we're contact tracing, we know how they were exposed and where they were exposed as a good indicator that we are back into sporadic cases. So if you look at the report and you remember the presentation we just went through, that stage 3 or phase 3, in order for us to be in that stage, we need to have sporadic cases. So it's not just only having 14 days of decline and another 14 days of decline and another 14 days of decline. It's about ensuring that our community transmission or our community spread is back to a situation or back to an environment where the cases are sporadic and we know how people's risk is for being exposed. The other thing that we'll have to look at is the positivity rate. So we've talked a lot about having the ability to do testing and to do testing broadly around the community, but the percentage of people who test positive needs to continue to decline in each phase. So those are the types of metrics that become more important as you move through your phases of reopening. And we'll talk more about that as we roll out our testing strategy and get into those details next week.
Mm-hmm. Mark?
Muriel Bowser, so to follow up on just May 29th as a possibility.
Yep.
If you talked about the trend in the epi curve and community spread is heading in the right direction, but you also acknowledged that you're not there yet for contact tracers. So, and also I note that in the hospital data, the capacity has gone from 72% to 77%. I know 80% is kind of the cutoff. So are you concerned about those two metrics not going in the right direction? And what if you get to all the other metrics and you're still not at contact tracing by the 29th? Would you still go forward?
We will be as close to where we need to be with contact tracing by the 29th that we will go forward. We have the IT infrastructure and we have the people that we need to start phase 1. We just need them to be completed with their training, which will happen just a couple of days later. So by next Friday, we will be where we are. Now, Dr. Nesbitt, of course, will continue to closely follow hospitalizations. And she reported to me this morning, actually, that a part of the increase in hospitalizations that you see is non-COVID related. And I'll turn to Dr. Nesbitt to talk about that.
Yes, so we've been closely monitoring how the percent capacity across the health system changes as a function of COVID-related care, and are looking at that. There were a couple of times last week where we noticed the overall hospital capacity was 76%, but we were observing very low rates of admission or comparatively low rates of admission for COVID patients. And so those could be a couple of things where perhaps you will recall that we had a conversation where we were really imploring members of the community to not delay going to the hospital for emergency services or for health care that was not related to COVID. And so I would be reassured if people are actually starting to do more of that and receiving services that are not related to COVID, and that's a reason why we're seeing that number go up. We do have the ability to provide people care that's not related to COVID in our system. We've set the number at 80%. Because of what our hospital and healthcare system can do and do safely without operating in crisis. So we'll continue to keep our eyes on that number. And we furthermore have built an alternate care site to be able to assist, and our hospital has some additional capacity within it if we needed to medical surge. So our 80% number that we've set is very conservative. It's actually extremely conservative because it's our operating number at baseline. It doesn't even take into consideration the additional 1,004 beds that have been built within the hospital system that we would still have to be able to take care of people within hospitals, which is the preferred place for people to receive care. Yes.
Based on the epicurve, it's day 11 now. Day 14 would be Sunday, which means that day 15 would be Monday. Do you consider, Mayor or Dr. Nesbitt, that you'd be in stage 1 as of Monday or Tuesday?
We will be in stage 1 when there is a mayor's order that indicates that I've lifted the stay-at-home order. And I anticipate that we will have an update to that on Tuesday. And I further anticipate that we would be making business changes by Friday, as long as these trends hold.
You would have some indoor dining. Right now, basically no one around here is doing any indoor dining. Are you basing that also on what Maryland and Virginia is going to be doing?
No, we're basing it on the committee's recommendations. I will say, however, that we have spent some time in the last week in discussions with the counties that surround us in both Maryland and Virginia, and there are some differences in how we're collecting data and information, but we have committed to share with them, as we have as recently as yesterday, what the data on the ground in D.C. looks like, and what we anticipate from these recommendations being operationalized.
They have 1,700 tests given for people without any restrictions, free tests. They turn people away. Do you foresee a time in the near future, Mayor, where you would allow something like that, or be able to conduct testing for free without any restrictions?
We already conduct testing for free.
Without restrictions?
What do you mean? With
anybody who wanted to get a test?
We have started last week. I think it's been reported in hard-hit communities in Washington having walk-up testing, where you don't need an appointment, like you don't need to call a line. You can show up, register, and get tested. I think we had nearly 300 people in one community. We're going to be in Columbia Heights this weekend, and then we'll also be in Greenleaf in Ward 6 next week. I mentioned earlier that there would be, that we would also release a reopening testing strategy, because you're right, as we reopen, we want more people to be able to, as they think about coming to work, or be able to walk up to a testing site. So we will be able to talk a little bit more about that next week. Alex Coma. Alex?
Hey, can you all hear me?
Yes.
Great. Perhaps this question is best suited to folks on the Reopen Committee itself, but I had a question specifically about some of its recommendations as they relate to outdoor dining and the closure of more public streets and public spaces. I can see in there it certainly says that that's a recommendation of the group, but I know the council was very much waiting on more specifics as they tried to develop policy around that. Have they discussed any more specifics beyond simply, saying that that's something you should consider, and how that would work to offer more guidance to the mayor and the council?
I'll turn to the chairs first. Were you able to hear that question?
Yes. I'm happy to take it. Our
Yeah, go ahead,
goal
Susan.
was Thank you, Michael. Our role was to hear from stakeholders, businesses, citizens, and take their inputs. A clear-cut recommendation that came was that it would be advantageous, both from a quality of life point of view and a business point of view, if in this process of reopening, beginning to the extent possible in stage one, that we had additional space in sidewalks and streets for restaurants and others and retail entities to be able to serve the public more from the outside. It's not the expertise nor the responsibility of the committee to tell the city exactly how to do that or where to do that. That's got to be something that is done at the city level. But our perspective and our recommendation was that it would be mutually beneficial for businesses and residents to have that expanded capacity where it's feasible.
And I would add that we've seen in a number of other locations around the country, there are communities that have taken the opportunity to put certain streets, dedicate them to foot traffic and pedestrians as opposed to having automobiles. And so that's an example of creating some space that people can safely move around in or engage in activities in because it's outdoors and it's not, you're not forced in close quarters.
Thank you, Alex. Is Amar?
Thank you.
Amar from AP.
Hi, thank you. Mayor Bowser, can you expand on your conversation with President Trump earlier this week? What, if any, assurances did you get from the president to get an additional $750 million in federal coronavirus relief funding to put the district on the same footing as states? And how important is that funding to getting D.C. back to a semblance of normalcy?
Well, it is very important that the district is made whole and that the district gets what it's owed. And I don't have to tell you, but I will, that we pay federal taxes. We pay more federal taxes than 22 states. We're larger than 22 states, and we are not a territory. And so the language and the appropriation from CARES 1 has to be fixed. We have been working, certainly our Congresswoman and Speaker Pelosi have included the language that we need in the HEROES bill. We encourage the Senate to take it up and advance it, which would give us the $775 million appropriation, as well as make sure that we get state-level funding and any other funding that goes to states and localities. That's first. I have also had that conversation with members of the Trump administration, including the president himself, and I will keep advancing that point. We not only want House Democrats, we want the Senate, and we want the White House to support making D.C. whole. Yes, Bennett.
Hi, Bennett with the Post here.
Yes, I can hear you.
All right, so the recommendation says that a stage 4 would be when there's an effective vaccine or cure. What happens if there's no vaccine for years?
I don't know that anybody expects that to be the case. Even on the outside, we've heard it could be 18 months. And certainly we're going to work with the health data and what we think is safe for residents in Washington, D.C. So I don't know that I can say much more about that hypothetical.
Should residents be bracing for the possibility that there's going to be restrictions for well more than a year if it does take 18 months or longer to have the vaccine?
I think residents should be assured that we are going to make health recommendations that keep us safe in the city, do our very best to contain the virus, and make sure that we have hospital capacity to deal with people who are sick. That's what residents want. That's also what businesses want. Yes, Mark. Hold on 1 second.
On the Metries,
Go ahead, Bennett.
On the metric for community spread, I know that you're excluding congregate cases. Does that apply to both staff and residents, and staff would be going in and out of these facilities?
It applies to the residents of those facilities, or it applies to the residents of those facilities. It should be noted that the majority, although we track for our internal processes and awareness the staff-related cases, it should be noted that the majority of staff cases associated with our congregate facilities are actually cases for other states.
Mark?
Mayor, two questions. One, have you talked in your conversation with the president or anyone in the federal government about going into phase one and telecommuting for federal employees? And it's strongly recommended under your recommendations here. I'm just wondering, did you have that conversation, or where does that stand?
I didn't speak with the president about that. My very specific focus with that conversation was on the money that the district is owed, but we have had that conversation with the Office of Personnel Management, and Metro, and talking to General Manager Wiedenfeld, has also communicated Metro's capacity and ability to turn on Metro as well, and indicated the need for phasing in federal employees.
And did they give you any assurance, hint of what they might be doing?
There was a guidance a couple of weeks ago that directed agencies to follow local jurisdictions, and we haven't heard anything otherwise. But we will continue to engage with them on that issue.
And then another question on the recommendations, and I don't know if Chairman Mendelson, I see him, I don't know if he can participate in this, but for both of you, I guess, what role, if any, will the council play in the recommendations, and what recommendations to accept? Will the council have any role in that?
In the phasing?
And in how it will, yes.
In the phasing,
not the science of determining when to go, obviously, but the implementations of rolling back the stay-at-home order and reopening.
Well, the stay-at-home order, as you know, is an executive order, and so it is lifted by executive order, or it is revised, is how we anticipate that it will happen. So we won't just completely lift it, we'll change it. It's likely to be a phased one reopening order, which outlines what types of activity can proceed and makes reference to those that are still limited. So that's what will happen. As we go through the recommendations, Mark, there may be changes to the law that are required to implement any number of the recommendations. I don't know off the top which ones require legislative support. The council, I don't want to speak for the chairman, I think he can mic in, but the council may also see these recommendations and have policy ideas of their own and may want to work together. The approach that we have followed throughout this response, and which has worked well, is that the chairman and I and members of the council have discussed consensus items, and those items have largely been urgent ones and had to move by emergency, and that's how the council has acted. And that, I think, has worked well in a pandemic response. I can see the chairman. Chairman, can you hear us? I can hear you. Okay. Okay, you bet. Any other questions? Bennett? Oh, Perry. I'm sorry, Perry from the Washington Post.
Yes, hi, can you hear me here?
I can hear you, Perry.
Thank you very much. I had two education-related questions. One, real quick, am I right in reading this report that this report does not recommend that schools go back to full in-person learning where everyone's there until there is an effective cure or vaccine?
Dr. Nesbitt, I'm gonna turn to Dr. Nesbitt.
That is not the current interpretation of the recommendations. The current interpretation of the recommendations is that there may need to be a modification, or there is a recommendation for a modification of the in-person learning environment until there is a vaccine, where certain social distancing requirements would be put into place. For example, how the classroom is designed, that the teacher would move from classroom to classroom instead of the students, and that in certain circumstances, depending on where we are with community transmission, that there may be even an approach where there is an A group of students and a B group of students, and that they attend classes or school on alternate days. So those are the types of things that our educational or our local education agencies or LEAs are planning for, so that when and if in-person learning can resume, they will have a number of options to use.
Got it. And thank you. And my second question is what does select schools may open mean in phase 2? And do you expect certain schools based on their capacities to look different? For instance, an overcrowded school may look different in phase 2 as to who can attend than an undercapacity school.
Well, Perry, I think you're asking some questions now that are going to take some analysis by DCPS and other LEAs. And we expect to talk, I don't know if we'll get to specifically to that question tomorrow, but we're going to talk more about schools tomorrow. And Fennett from the Washington Post.
Hi, Mayor. I don't know if you've been asked this before, but do you see the presidential inauguration going on in 2021 as it has in past years?
I hope so, but I think you know that there is some guidance here about parades. Let me turn to it because it's not on the top of my. Where are we with which group is that in?
Large gatherings, outdoor and indoor large gatherings.
Okay, large gatherings, indoor and outdoor gatherings. And we don't know what parades will look like or events outside will look like beyond 250 people through stage 3.
And do you have authority? Do you have authority to bar mass gatherings for a presidential inauguration?
I would have to confer with all of our legal. I think you know that we support mass gatherings of all sorts that are local, that are federal, that are First Amendment, and that is our great privilege as the nation's capital. But there is a lot of federal and local and regional cooperation and planning leading up to that. We have already started our inaugural planning as we do. We started it before the pandemic, and we'll just have to check in with where all of that is and where our health data is and where we are, so that we can support any national, regional, and local planning. Annalisa?
Hi, Mayor Bowser. Just checking in on the unemployment benefit payments for those who are still waiting. We're about 9 days away from June rent. For those who are still waiting, what do you have to say in terms of recommendations for expediting the process if they have complicated situations?
We actually, Annalisa, are going to give a situational update on unemployment numbers tomorrow when the DOES director is with me talking about summer. I still think that we're about 90,000 plus DC workers who have applied for unemployment. We will continue to report how each group who has applied by week and the disposition of their claims by week to give us an idea of where people are. My sense is, Annalisa, that people who applied early on have long been receiving their weekly payments in addition to the $600 CARES payment. And if there are particular cases, we have a resolution process at DOES to deal with those. So we will be able to address at a high level tomorrow where we are with unemployment claims. Okay. Yes, Mark, I think you have the last question.
Thanks. If I could just follow up on Bennett's and look a little closer on the calendar to July 4th. What are you going to do if the federal government decides to have fireworks on July 4th?
Well, we're going to continue to work with our federal partners, Mark, to let them know what the situation is in Washington, D.C., and how it's going to keep us safe, how we think what we need to see happen in D.C. To continue the phases of reopening and move from there.
Question, do you have the authority to do something like you did at the Cherry Blossoms, close the roads around them to discourage people from coming in for such an event?
I think we support, we use our 4,000 police officers, men and women, to make sure we can have safe federal events. And that is generally our interaction with a federal program to help them with road closures and to help them with movements in security.
And then my last question, on the recommendations, it does not have pools opening until phase 3.
I know.
Well, so does that mean no mayoral cannonball this year? And what does that mean for swimming pools this year?
I know. This is tough, right? And trust me when I say this, we have kicked the tires on this many, many times. And we have beautiful pools. Our pools have been readied. And it is possible, even with these recommendations, to open pools this summer. If we quickly get to phase 3, it would be possible. But we don't have a high likelihood of that happening at this stage. So what we are concerned about with pools is the congregating. The pools themselves, I'm told, are just fine. But the congregating, the sitting around on benches, the use of the pool houses, the kids who, are going to be kids in the pool and water, it is just too difficult to be able to assure the appropriate social distancing around our pools. So at this point, we don't have a date where we can open pools for the summer. The outside opportunity would be late summer.
Have you gotten guidance from Dr. Fauci on this specific issue?
I think we talked to him about pools, yes.
What was his guidance?
I think that he didn't differ from us.
Is there evidence that the chlorine in the water kills the virus? That's why you believe the pools are going to be fine? Dr. Nesbitt?
So, as the mayor has stated, it is not the being in the pool itself that is of the concern. It is the other activities that occur around the pool.
Any kind of study showing that?
I've answered your question.
So you haven't.
I've answered your question. There's published evidence around this. I've answered your question. I've answered
published
your question.
Evidence,
she
said.
You can visit the CDC's website around guidelines for pools. Thank you.
Thank you, everyone. Thank you, Madam Chair. Thank you, Mr. Chairman. Thank you, everybody. Thanks, Jeff.
Thank you, Madam Mayor. Thank you, Mike.
Thank you, Mayor.
Thank you, Mayor.
We now return to our previously scheduled program, already in progress.